Meet Dr. Harold Freeman, former American Cancer Society president. In 1989, he led a national hearing to listen to the testimonies of Americans living in poverty who had been diagnosed with cancer. The results were a turning point in the way we looked at cancer treatment. Dr. Freeman concluded that people living in poverty meet significant barriers when they attempt to seek a diagnosis and treatment of cancer. They often do not seek care if they cannot pay for it. They experience more pain, suffering, and death because their diagnosis comes at a later stage. They feel fatalism or despair about cancer that prevents them from seeking care. And people living in poverty and their families must make extraordinary sacrifices to obtain and pay for care. After realizing his findings, Dr. Freeman said,
"No person in America with cancer should go untreated, experience delays in diagnosis and treatment that jeopardize survival, or be bankrupted by the inability to pay for treatment. People should not die because they are poor, black, or uninsured. This is more than a medical and scientific issue. This is a moral issue."
Galvanized by what was learned in these hearings, Dr. Freeman came up with the idea to navigate patients and coined the term patient navigation.
I was thinking of a metaphor for what patients have to do to negotiate the medical system. That of being on a small boat in the South Seas, when you can see an island in the distance you want to get to, but there are rocks in between. And if you hit them, you'll sink and possibly die. But let's say there's a navigator on board who can chart the course and get you there safely.
So, in 1990, Dr. Freeman started the first patient navigator program at the Harlem hospital system in New York. He wanted to show that the community could take an active role in their care. He wanted to save lives. He wanted to take the fear out of getting health care. He wanted to ensure equal access. And he wanted health systems to change, to revolve around the patient. Research showed that the Harlem program dramatically improved survivorship for navigated cancer patients, demonstrating how local action can reduce illness and death among vulnerable populations. Because of these early successes, patient navigation expanded dramatically with ACS at the helm, and patient navigators work tirelessly today in many healthcare facilities around the United States. And it continues to expand because we agree with Dr. Freeman when he said,
No person with cancer should have to spend more time fighting their way through the cancer care system than fighting their disease.